name is Tess, this is Abby, this is Taylor and Zoe. We are going to be presenting breast cancer for our cancer project today. Feel free to comment below with any questions.
So what is breast cancer? It's cancer cells that grow at a rapid rate within the breast tissues. The cancer can begin in different parts of the breast. Two main types are invasive ductal carcinoma and invasive lobular carcinoma. The biology of the breast, it has three main parts: the lobules, the ducts, and the connective tissue. The ducts are tubes that carry milk into the nipple. The lobules are the glands of the breast that produce milk, and the connective tissue is what holds everything together. Breast cancer starting in the lobules or ducts is most common.
Symptoms of breast cancer is swelling of an area or all of a breast, skin dimpling, breast or nipple pain, nipple retraction, breast or nipple skin that is red, dry, flaking, or thickened, nipple discharge, swollen lymph nodes under the arm or near the collarbone area. Invasive ductal carcinoma is abnormal cells grow in the lining of the milk duct and invade breast tissue beyond the walls of the ducts. Cancer cells can peak if they break into the lymph nodes or bloodstream, where cancer can travel to other organs and areas of the body, which is metastatic breast cancer. Men can be affected with this type of breast cancer as well. Diagnosed with mammogram, breast ultrasound, and a biopsy.
Invasive lobular carcinoma is the second most common type of breast cancer, affecting about 10% of people diagnosed with breast cancer. Carcinoma refers to any cancer that originates within skin tissues, such as breast tissue. Usually symptoms of invasive lobular carcinoma are swelling, pain in the breast, or dimpling. You're less likely to feel a hard knot with this. More often with this type of breast cancer, you feel a swollen, thick mass. A mammogram and breast biopsy is the testing used to diagnose ILC. Risk factors for breast cancer is a family history, women age of 40 and older, obesity, abnormal cells on mammograms, Caucasian and African American women, physical inactivity and lifestyle, women that are never pregnant in their lifetime.
How to reduce the risk factors are to increase activity, healthy eating options like fruits and vegetables, avoid alcohol, breast cancer screenings like mammograms, self-breast exams or clinical breast exams, and then pregnancy and oral contraceptives. For mammograms, so it's an x-ray of your breast tissue that looks for any abnormalities. It's done by a technician. They will position your breast on a plate, and another plate will compress your tissue until it's relatively flat and holds the tissue in place while an x-ray is taking. The process is repeated on both sides of your breast, and you will feel some pressure. In a few days, your test results will be back, and you can go over them with your doctor. Women who are 40 to 45 should start getting a mammogram yearly to help with early detection of breast cancer, and it can be started earlier if you have any family history of breast cancer. And this next slide is a demonstration of how a mammogram works.
So common breast cancer treatment options: there's breast conserving surgery. Cancer will be removed and most of the healthy tissue is left in the breast, usually as a lumpectomy or partial mastectomy. Treatment is used for small localized breast cancer. There's also radiation, which is used to shrink tumors before surgery or to kill any remaining cancer after surgery. Chemotherapy, depending on the type of cancer, is medication that can be used alone or following the surgery. Or hormone therapy. Estrogen and progesterone affect some breast cancers. Physicians can describe these as estrogen positive receptor or progesterone positive receptors. Hormone therapy works by stopping these hormones getting to the breast cancer cells. These are all of our references.
Thank you, and like we said, feel free to comment a question below, and we will be back to you with that answer.